I would like to introduce our first panelist, Dr. Gobir.
Thank you, Nate. As we say in Islam, Assalamu alaikum wa rahmatullahi wa barakatuh, which is just basically means peace be upon everyone. My name is Ibrahim Bola Gobir, and I'll be talking about faith, health, and trust from the Islamic faith perspective, and then I will dovetail into specific examples, at least for Nigeria. Next slide, please. So again, just in terms of a little bit of background information with regards to population of Muslim globally, and then most importantly is to also see the distribution of the Islamic faith in Nigeria, with predominantly with a large predominance in the northern part of the country, as we can see on the map in areas highlighted in green. And within the Islamic faith sector, we have different existing community networks ranging from Islamic schools to informal congregations, and some of them have been able to formalize their structures to even the mosque itself. These are trusted structures that are able to reach a lot of people on a daily basis, and these networks operate on the principle of do not, throw yourself into destruction with your own hands, which is basically a citation from the Quran. Next slide. I try to use this as an example of something that is not far-fetched. I came up with this particular comic whereby a child who is already been introduced into doing ablution to perform prayers, which is basically you wash up yourself a little bit and then you go and perform prayers during an Ebola outbreak, and then the mother was able to use that opportunity to actually talk to the child about putting salt in that water that we use for ablution and then bathing. And typically what the mother basically was saying is this is something that was going to protect the child from Ebola. Now, the reality of the matter is this actually even happened to me. So I'm actually the child in this question. And this happened during the Ebola outbreak. I think the last one that we had where we had soya in Nigeria. And my mother actually called me as a doctor to tell me the same thing, to say that, have you done this morning? Have you prayed? And I said, yes, I'm about to pray. And she literally said, okay, before you pray, recite a few verses from the Quran into that water that you want to use for doing ablution, and then you can use that to bathe yourself, and then you can go ahead and pray. And when I asked her where did she get this information from, of course, she said she got it from, a network of for an informal Islamic gathering. And for me, that kind of just resonated with me whenever you're talking about the impact on faith in terms of sharing information out there. Next slide, please. So when we talk about faith itself, there are a lot of structures on ground that within the Islamic faith. It ranges from having imams. Imams are actually those leaders who actually lead prayers. These imams are present in the mosque. Within the mosque, there are others that are also that are not necessarily imams, but they also contribute to driving the Islamic faith. These are structures that exist within the community. But the structures alone are not enough to drive what we're talking about with regards to a health system or supporting community system. What drives it is actually the trust that people have in a lot of these in a lot of these faith leaders. With trust, once trust exists, which is basically what the faith leaders in the Islamic sector have been able to use, it facilitates community acceptance, community cooperation, adherence, and reporting, which invariably, of course, leads into improved health outcomes. And I will be citing specific examples quickly around some of the health outcomes of interest with examples basically from Nigeria. Next slide, please. So I'd already talked about this earlier with regards to the different networks that we have within the Islamic faith, from the mosque, the Quranic school, the community structures, as well as, fellowships, on informal fellowship that we've had in Nigeria. Again, the unifying factor here is actually trust, because what is resident here across all of these networks are largely, you are looking at the trust that they are able to bring. And that trust is what they've been able to use, to communicate in all of these different networks, ranging from the Quranic school itself to the mosque, when you have all of this conversation, and then even to the fellowship as well as community structures. With this, it enabled the network to be able to communicate faster, mobilize a lot of people, educate, as well as also provide social support. Next slide, please. So in terms of Islamic principles that support public health, we have some of these, and again, maybe one of them is particularly critical and important when you're talking about Ebola. So generally, the principle that reinforces public health starts from preservation of life, to seeking treatment, to preventing harm, as well as collective responsibility of supporting the community. But most importantly, some of the practices in Islam that ranges from ablution when we want to pray, where you have to wash your hand, your face, your feet, to even fasting during the month of Ramadan, to avoidance from harmful substances like alcohol and the rest, to even zakat, which speaks to hands, and then the earlier burial. Now, earlier burial is the one that I probably want to hold on to for on this particular instance, especially if you're looking at outbreak. We used to crack a joke that in Islam, if somebody just make the mistake to kind of just drift or you doze off, if you try to wake you a couple of times and you don't wake up, you've long been buried. That's not necessarily true. At least you try to ascertain that the person is really dead. But the principle for Islam is largely early burial, and you do a dignifying burial, which again, if somebody is looking at it in the context of the Ebola outbreak, right, at this particular point in time, it makes it a lot easier to actually be able to communicate or leverage these Islamic scholars in driving introducing infection control into whatever they really need to do with regards to burying. Burying somebody early is usually a challenge generally in most parts of Africa and even in Nigeria, but with Islamic faith, it's just a layer on to say, hey, you perhaps just need to introduce a little bit of IPC into or infection prevention and control into what you do for you to potentially be able to actually bury this person, since the principle already allow for early burial to take place. Next slide, please. So the last set of examples that I really want to give with regards to Nigeria is the polio eradication example as well as COVID-19 response. Now, both of them were viral infections, and both of them also have something in common, which is deployment of vaccines. For a state, for example, in Nigeria, the Kano state, there was a particular instance where, there was vaccine that was introduced for meningitis, and that caused a lot of problems for the children that were under 5. And the faith leaders were rapidly able to go out there and, communicate or share information with the community on why people should move away from actually taking those vaccines. And that kind of just skyrocketed or snowballed into other potential vaccine preventable diseases. So with the polio, it was also a challenge because there was that initial kickback because the faith leaders have not necessarily gone back to communicate to the community and let them understand that this is different, But when the government was able to sort of just leverage the faith leaders, at least in a place like Kano, it was a lot easier for them to now, convince the community that you can go ahead and actually take on this vaccine. And the same thing with COVID. In Islam, there's a lot about congregational prayers. And for men, for example, you are not necessarily, it is recommended that most men should go out and pray in the mosque rather than praying alone. So by the time we're looking at social distancing and the rest of them, some of the Islamic leaders felt, you are basically just trying to tell us that we cannot have congregational prayers again. You want us to just stand alone and be praying, when the recommendation from the Islamic faith is that we should congregate and pray together. That pray 5 times a day for men, especially if you can do that in the mosque, and suddenly you are now talking about social distancing, and then come in, of course, the introduction of the vaccine. But then with the engagement of the faith leaders within the Islamic sector, letting them understand that this is the reason why we have to do this, it was a lot easier for them to actually go back and let the community know that this is not tied to the religion. We're not saying don't have your congregational prayer, but this is as part of protecting everyone. So what that taught us really is that trusted leaders accelerate acceptance, at least within the Nigerian context. Faith institutions amplify public health messaging, and community engagement through the faith leaders reduces resistance. Next slide, please. So I'll end my presentation here, or my opening remark here, by saying, at least from a Nigerian context perspective, people often listen to those who pray with them before those who prescribe with them. So you will see that when those faith actors start talking to the community about ill health, about public health intervention, people listen faster, even before those of us who are care providers. So it's to our own advantage if we can actually focus on working through this particular faith network to drive trust within the community. Thank you very much.
Thank you, Bola, for an excellent presentation.